Welcome to this clinical deep dive for the emergency physician on acute aortic syndromes. We begin by exploring the spectrum of this disease, incorporating perspectives from Tintinelli and Rosen. Acute aortic syndromes include aortic dissection, a tear in the intima creating a false lumen, intramural hematoma, which is a hemorrhage within the aortic wall, and penetrating ulcer, where an atherosclerotic plaque ulcerates into the media. The Stanford classification divides dissections into Type A, involving the ascending aorta and requiring surgical emergency, and Type B, involving only the descending aorta, which is primarily managed medically. Clinical red flags include pain with an abrupt, maximal onset, described as tearing, and migrating pain. The presence of a neurologic deficit combined with chest pain is also a major red flag. Key findings during a physical exam include pulse deficits, a blood pressure differential of more than 20 millimeters of mercury between arms, new aortic regurgitation, and neurologic loss. Time is crucial. For untreated Stanford Type A dissection, the risk of mortality increases by 1 to 2% every hour. Early identification and anti-impulse therapy are non-negotiable for survival. The diagnostic gold standard is CTA chest/abdomen, which provides detailed anatomy. POCUS, or TEE, offers rapid bedside identification of intimal flaps or aortic root dilation in unstable patients. Anti-impulse goals focus on reducing heart rate to less than 60 bpm, controlling blood pressure to an SBP between 100 and 120 millimeters of mercury, and aggressively managing pain to blunt sympathetic surge. In terms of agent efficacy, esmolol allows for rapid titration and immediate cessation if blood pressure drops. Labetalol and nitroprusside are also effective agents. The ED clinical journey includes stabilization with analgesia and anti-impulse titration, obtaining a stat CTA, early consultation with CT surgery for Type A, and disposition to the OR, or a high-acuity ICU. Thank you for watching this video. Remember, aortic emergencies wait for no one. Here are the image sources used throughout this video.